Welcome. My name is Peter Strong. I'm a professional psychotherapist specializing in mindfulness therapy, and I provide online mindfulness-based psychotherapy for treating anxiety and depression without using drugs. So, mindfulness therapy is extremely effective for helping you change the underlying cause of your anxiety or depression or any other form of emotional suffering that affects the quality of your life. We work at the level of the reactive habits, the reactive thinking, and the patterns of emotional reactivity that produce our anxiety and depression. We learn to see these patterns, and we learn to help them change by becoming more conscious and by developing a conscious relationship with these patterns. So this is the first most important thing that we must do if we want to change. We have to develop a conscious and non-reactive relationship to our reactions. If you don't do that, then the reactions become habitual. That is, they become subconscious and continue to operate without any choice and without our control. But once you make them conscious, then you can begin to change them and produce the internal changes that are necessary to train yourself out of those habits. So anxiety and depression and most other forms of emotional suffering are really emotional habits. They are simply reactive habits that become established and then become subconscious and operate without our say. So the first step in mindfulness-based psychotherapy is learning to see these habits and then break free from the habitual nature that fuels the reactivity. Doing this on Skype is a very effective way of learning these mindfulness skills. You don't have to see a mindfulness therapist in person in order to learn how to work with your mind. You can do that very well via Skype. So that's why I offer online psychotherapy via Skype. It works really well, and the intention is to give you the tools so that you can break free from the habits of anxiety or depression without having to resort to medications or years of analytical therapy. Medications are not sufficient to change these psychological habits. That requires a form of psychological response, psychological training, or psychotherapy. But the function of our psychotherapy should be to see these habits and then change them consciously. The second most important part of mindfulness therapy, besides becoming more aware of our habits, is to look at the underlying emotional structure. So what is it that's driving those habits? So what is the nature of the underlying emotions that is driving our anxiety or depression or addiction or any other form of emotional suffering? So typically at the root of just about all emotional suffering, whether it's anger or guilt or addiction or self-hatred or anxiety or depression in its many different forms, you will find that underneath all of these outer forms of reactivity, you will find fear. Fear is usually the root energy source for anxiety and depression and all of the different forms of emotional suffering. So we learn to build a conscious and mindful relationship with this fear. That is essential. The habits simply take us away from that fear. They displace our attention away from the fear that needs us more than anything else. So to heal fear, we must develop a conscious and compassionate relationship with that fear. This is a central focus in mindfulness therapy, the system that I developed over the years and that I teach via Skype. It's all about learning how to develop a compassionate and friendly relationship with your anxiety and depression and with the fear underneath the anxiety and depression. So we learn to look at that fear in the same way that we might look at a child that was in a state of fear. We learn how to respond compassionately to that fear, the same way that we would respond compassionately to a child that was afraid, or to a friend that was suffering. This is vital for healing, developing this internal relationship. It's a relationship based on internal love. That is, love for the fear. We learn to take care of that fear and bring it what it most needs for healing, which is that love. So this we describe as developing an internal relationship between your true self, which is the origin of true love, and the little self, which is that fear. When that relationship is strong, then healing is very much accelerated, and the fear will heal in direct proportion to the strength of that internal relationship. So we learn how to bring love to our fear, to our pain, to our anger, to our guilt, to our compulsive thoughts, to our negative thoughts, whatever it is that's generating our suffering, that's what we must bring this internal love to, or mindfulness. Mindfulness basically is the conscious expression of love for our experience, whatever that is, whether it's neutral or suffering or whether it's joyful. If we bring conscious love to it, that will promote healing and well-being and greater joy in our life. So the way we do this is to actually learn how to meditate on our fear and other emotions and other parts of the mind that are stuck, that are in a state of suffering. We meditate on those emotions and thoughts and traumatic memories and so on. We do not avoid them. We do not try to talk ourselves out of experiencing those states of suffering, but rather we try to develop a conscious and friendly relationship with those parts of ourselves. This is vital. We do not indulge in the fear either. We do not indulge in anger or depression or anxiety. We instead develop a conscious and non-reactive relationship. That is the basis of love. This is necessary to produce healing. So we meditate on our emotions, we establish this strong internal relationship based on love, and then we explore what ways we can interact with the fear that will allow it to release its fear. that promotes healing. And so healing is the primary goal in mindfulness therapy, is to find the fear and then bring about its healing through our internal compassion and love and consciousness. So if you'd like to learn more about mindfulness-based psychotherapy via Skype, please go to my website and then email me. Ask any questions you may have about the process and how to get started with therapy via Skype. And when you feel ready, we can schedule your first Skype therapy session. The mindfulness therapy approach is extremely effective for the reasons that I've outlined briefly. Most people will see dramatic improvements within the first few sessions. The moment you start changing that relationship that you have with your emotions, the faster the healing happens. So if you'd like to learn more, please reach out to me by email and let's schedule a Skype therapy session. Thank you.